Hi, I'm Dr. Jordan Metzl. We're here today to talk about stress fractures. Many of you have heard the term stress fracture. What does it mean? Well, fracture is when a bone breaks. Stress fracture is when a bone starts to swell inside, and over time, it starts to crack. Now, who gets stress fractures? People that do a lot of loading on bones. So runners, soldiers doing a lot of marching is where these were initially described. What are some important points about stress fracture? First of all, how do you know if you're getting one? If you're getting worsening pain in a bone, the most common spots are the metatarsal bones in the feet and the shin bone, the tibia. That's the most common space you can get them, but you can get them anywhere around your body. If you're getting worsening pain that seems to worsen when you're exercising, you want to make sure you get that checked out. Now, what do you do if you're getting one of these? You go to your doctor right away. They may get an x-ray, but it's important to also know that most stress fractures don't show up on x-ray. And these days, we're using MRIs to look for swelling inside the bone called a stress fracture. Now, an important point for all the athletes, runners, triathletes, is if you're getting a stress fracture, it doesn't mean you need to sit on your couch and eat ice cream and feel sorry for yourself for 6 weeks till it heals. You need to make sure you keep your body moving, get all that fitness you've built up over time to get this stress fracture. Don't let it go to waste. Get in the pool, make sure you swim, talk to your doctor and ask them, what can I do to keep moving while this stress fracture is healing? Now, how do the stress fractures heal? They heal just over time, and you want to make sure you don't load that part of the body, and then figure out why this stress fracture happened. Is it because your foot's rolling in too much, changing the mechanics of your foot? Is your bone density low? Do you need to be on calcium and vitamin D supplementation? Is your strength not enough? Do we need to strengthen what you're doing? Are you putting in way too many miles running and you didn't build up your mileage quickly enough? These are all questions your doctor and you should think about together, because taking care of a stress fracture is a team approach. You need to make sure you let them know, I want to keep active, and they need to help you figure out not only how does the bone heal, but what can I do to make it heal faster. There's some new research in stress fractures in terms of getting these injuries to heal faster using things called bone stimulators. We're looking at different agents that we use sometimes to treat osteoporosis now, to look towards treating people with stress fractures with these agents to make them heal quicker. That'll all probably be in the future. But for right now, the key is proper diagnosis with a history, if it's sore on physical exam, and then getting the MRI to confirm it, and then figuring out how you're going to take care of it. So don't be discouraged if you have a stress fracture. It's a very fixable injury and one that we really can help you with once we figure out the right diagnosis.